Welcome back to the Morning Blend. It's one of the greatest joys a woman can experience, pregnancy. But it can also come with problems, specifically when it comes to hypertension. Here with more on that and its symptoms, Dr. Lauren Giacobbe from High Risk Pregnancy Center. Good morning and welcome.
Good morning, thank you.
Let's talk about some of the issues that can complicate pregnancy. What do you see often?
So with hypertension in pregnancy, there are two main categories. So there's chronic hypertension and preeclampsia. Chronic hypertension is elevated blood pressure, not just during pregnancy, but outside of pregnancy. So these women will enter pregnancy with their blood pressure already elevated, and sometimes even on medication. And then when they deliver, their blood pressure usually remains elevated. Then with preeclampsia, that's pregnancy specific. So their blood pressure becomes elevated during pregnancy, they deliver, and then their blood pressure normalizes, usually within a couple days to several weeks.
Now, how many people are affected by this high blood pressure, would you say?
High blood pressure in some form or another affects approximately 6 to 8% of pregnancies, so it's fairly common. We see it quite a bit.
Why do you think that happens?
Well, first of all, there's older women getting pregnant. I don't say older because I'm in that category too, but over age 35. So, and already having high blood pressure entering pregnancy. And then with preeclampsia, it's a very common thing that we see, more common in first pregnancies. So it's a very common condition. So,
the risk goes up with age then?
Correct. Mm-hmm. Well, the risk for chronic hypertension and then also preeclampsia. So.
And then the onset of the symptoms, you talked about it first trimester of the pregnancy, right from the beginning?
The onset of symptoms? Mm-hmm. Yeah, so actually with preeclampsia, a lot of times women won't have any symptoms, but if they do, usually they'll have a headache. They can have headache, blurry vision, seeing spots, so vision changes, as well as right upper quadrant pain. And so the right upper quadrant pain indicating possible liver involvement.
And what type of treatments can a woman go through to help them with this?
Well, so with preeclampsia, actually the ultimate treatment is delivery. So there's really not much to do to prevent it once it's started, but delivery is really the treatment. To prevent preeclampsia, we try to modify risk factors. So there are certain risk factors associated with it that we can modify some. And then more recent evidence has shown that actually aspirin, a baby aspirin, started at about 16 weeks of gestation in women who are at high risk for preeclampsia can help prevent that.
And that's still safe for the baby as well?
Correct, right, very safe.
Now for a woman who's thinking about getting pregnant, what are some things that she should think about, talk to her doctor about?
Just in general? Yeah, so anyone who has medical problems, so high blood pressure or any medical problem, diabetes, you want to optimize your health before you get pregnant. So make sure your blood pressure is well controlled, or if you have diabetes, your sugars are well controlled. So really just optimizing things before you get pregnant and talking about risks that could be associated with the pregnancy.
And is it common for people to go through some high-risk things while they are pregnant?
Yeah, no, very common. So more common to experience a high-risk pregnancy if you have a pre-existing medical condition entering pregnancy. So I think those things, it's always beneficial to meet with your doctor before you get pregnant to discuss those risks.
And for someone who's, let's say, trying to have a second baby or a third baby, are there things that they should know about? Is it typically easier once that first delivery is out of the way?
Right. Well, if you're talking about preeclampsia, actually, so preeclampsia is a disorder of first pregnancies. It's much more common in the first pregnancy, but unfortunately, if you had preeclampsia in the first pregnancy, you're at risk to have it again. So, you know, you're not out of the woods, I would say, necessarily. So.
Yes. And you're new to the Vegas area.
Correct.
Tell us why you decided to start practice here.
Well, I came to interview and I really just fell in love with the group. The perinatologists are wonderful, but all of the staff, I went and met a large majority of them. Everyone's very friendly and really seemed to enjoy their job. And so since I've started, you know, it's just a very cohesive group. They really work together and do their job with a really good attitude, and the goal being the patient care. So I think it's just it's been a great place to work so far.
And just very quickly before we wrap up here, anything you'd like to say to women who are going through some tough times right now during their pregnancy?
Well, it's scary. You know, it's scary to be pregnant, even with a pregnancy where you don't have any complications. And when there is a complication, it's good to have people that you can talk to. So if you do have a high-risk pregnancy, of course, coming to our center and seeing us, and also having support from your friends and family and just people to talk to, because it can definitely be a scary time.
Yeah. Well, Doctor, thank you so much.
Thank you.
Appreciate it. The High Risk Pregnancy Center has 2 locations in Vegas and 1 in Henderson. To learn more about the group, just head to hrpregnancy.com or call the number on your screen. Still